Hello and welcome to another edition of Health in the Heartland, a program dedicated to the health issues that affect you. I'm Karen Blakelock, and with Father's Day just around the corner, this episode we're encouraging the men in our lives to seek preventative health care. Joining me is Dr. Paul Gerald, family physician with Freeman Creek Family Care Center at Heart Memorial Health. Welcome, Dr. Gerald.
Thank you, Karen. Glad to be here.
Well, let's talk a little bit about, traditionally men tend to shy away from going to get preventative health care. Why do we think that happens?
Well, there's probably several reasons, but they do. A lot of people just deny that there's problems that they need to work on, and men are a little worse than that than women. But they don't tend to seek health care at all ages, young and old, as often as women do.
I agree, and I think if we look at the lifespan of men, and maybe starting at age 20s, what would be their major health concerns in their 20s?
Well, much is preventive. This year, for the first time in the United States, stroke and heart attack dropped to the number 2 killer of people, both men and women, and cancer has always been number 2. Cancer is not increasing, but because we're controlling blood pressure, because people with high cholesterol are taking statins, and because people are not smoking as much, stroke and heart attack, that was always number 1 by a long ways, has dropped down to the second leading killer, which is an enormous change. And so, but it's on those 3 things. It's not smoking, taking blood pressure medicines if you have high blood pressure, and taking statins, Lipitor, Zocor, Simvastatin, atorvastatin, medicines like that if you have high cholesterol. And the high cholesterol part and the blood pressure part and the non-smoking are all things preventive. Those are things that men need to do, and women, in their 20s or 30s, rather than waiting until they're
Right.
older.
So starting, if you think about maybe starting in their age 20-ishes, right? They need to maybe find out genetically what they might be predisposed to. We know their genes do have a tendency to play a part as far as cancer, heart disease, and different things too.
Absolutely. As far as what we die from, genes load the gun, and your lifestyle pulls the trigger. And you can't do much about your genes, but if your parents, sisters, brothers have high blood pressure, if you have a strong risk of colon cancer or any kind of cancer, if you tend to have high cholesterol or heart problems, those are things that we need to know about, and then we can if we start working on them though in the 20s or 30s, when men are young, then we don't have problems in their 50s, 60s, and beyond.
Right, and I think it's important to get that foundation, and then you can make some lifestyle choices based upon that. And of course, it's all about choices. We know that, right?
It's all about choices.
It
and
is.
we have more smokers in Kentucky than any state in the union, and to not smoke or use any kind of tobacco is a good idea. Now, smoking is the worst, and using snuff or chewing tobacco is a lesser problem, but still a problem. But most people know about tobacco, and but how to do something about it is the key, and it's 3 things. It's either use Chantix or use Wellbutrin, which is an old antidepressant which works for stopping smoking, or taking the nicotine products, or doing it cold turkey if you wish. But not taking in tobacco in any way, shape, or form is important. There's one other way of stopping smoking that's less traditional and doesn't happen as much, but it does work. It's called aversion, and if you get the strongest cigarettes you can, smoke them just as fast as you can until you make yourself sick on 3 successive days, that has a stop rate of about 50%. Not very many people try it because it's somewhat difficult and uncomfortable, but it works. But the point is, to not use tobacco is very, very important.
And additionally, I think, as we talk about choices, accidents tend to be a large reason for death in their 20s, as we look at that for that population. So, making sure you put on your seatbelt, wearing a helmet if you're a motorcycle rider, those types of things to make sure that you're making some good choices as far as lowering your risk.
Actually, and most of my people, and I take care of a population that mainly does wear their seatbelt, and with the seatbelt and airbags, your car has to pretty much flip to get to for you to have troubles. But the motorcycle is a whole different issue. The death rate is so high that you certainly want to wear a helmet if you ride, but not riding is better than riding. I ride a bicycle, but a bicycle is not, and I commute to work on my bicycle, but that does not have the death rate that motorcycles do, just because of the speed. When I fall off my motorcycle from time to time, but then I get bruised, but I don't get killed. But accidents are important in younger people. I wear a helmet all the time.
You wear a helmet on that bike.
I wear a helmet all the time on the bicycle.
That's important. Now, we've kind of started with the 20s, and as we look at the 20s and 30s, there are some, we've talked about the foundation, knowing your genetic background and making good, healthy lifestyle choices. What are some basic numbers that we need to know as far as health screenings, like maybe our cholesterol, blood pressure, those types of things too? Well,
you mentioned the most important things, and what you want to know that you don't know by yourself is what your blood pressure is, because 140 over 90, and if either number is higher, that's considered high blood pressure. And you can't tell that. And so to know what that is very, very important. And that's one thing where a young person, it's a good idea for a young person to be screened by their provider. Knowing what your cholesterol is. And you don't have to have it often, but at least one time is important. And then just there's things about a healthy diet that's important. And a healthy diet is very simple. It's you can eat all the fruits and vegetables you want except for potatoes. You eat one serving of pasta or bread and one serving of meat and no calories in your drinks. And basically every good diet is based on some conception of that. It's just a diet that has a lot of fruit and vegetables. At least 7 servings of fruit or vegetables is a good idea. And if you're eating that much fruit, that's a lot of food. And you can go up to 11 if you can get that many in. You really have to work to get in 11 servings of fruits and vegetables. But if you get in at least 7, you don't have room for a lot of calorie-dense things. And
these are healthier calories for us than picking up the bag of chips or something that's prepackaged generally.
And all those things, chips, snack foods, are calorie-dense. Bread, that's all calorie-dense. A lot of people think that whole grain bread is better. It is better, but it has the same number of calories. That the way you have to do bread is how many calories are in it. And these really thin slices or these really thin buns are the best because they've got fewer calories.
Right. So making good choices, we've talked about getting that foundation as far as your genetic background, getting screened, getting your blood pressure checked, making sure you get your cholesterol checked. What about diabetes? Kentucky, we have a high risk for diabetes. When should that start being checked for what they call your blood glucose?
Well, that a lot of times depends on how much you weigh, and if your BMI, which is a measure of kilograms per meter squared, but anyway, it's a chart, and if your BMI is over 25, you've got a higher risk of diabetes. You only have to carry an extra 35 pounds, which isn't much for the insulin in your body, or for your pancreas to have to secrete double the amount of insulin. And after your pancreas secretes this every day, day after day, double the amount of insulin, your pancreas finally just wears out and it can't do anymore, and then you're a type 2 diabetic. And we've got a huge epidemic of type 2 diabetes in this country.
And even starting now, with childhood, we're seeing a large population at risk for diabetes.
It's never happened before. We've never seen children become diabetics at this rate. We're raising a group of children that are so heavy that they're going to live a shorter period of time than their parents, and that's never happened before in the United States.
Which is frightening. So this is why we're talking about preventative health care today, and knowing your numbers, knowing your background, what are your risk factors, and making those good choices. So when we get screened for your cholesterol level and maybe your blood glucose, that's a simple blood test, and
Yes.
you talk to your provider about getting that done. What are the numbers that they usually look for as far as maybe a fasting blood glucose level?
Diabetes is any blood sugar that's over 126, and pre-diabetes is between 100 and 126. Normal now is considered under 100. And so, but because so much of it does have to do with weight and exercise, if a person loses if they're overweight, if they lose 15 pounds and start exercising 30 minutes a day, 5 days a week, you cut your rate in half of type 2 diabetes. But we're seeing so many people carry so much weight, and 2/3 of adults in this country are either overweight or obese, and so we really need to emphasize 90% of it is diet. 90% of it is a plant-based diet. A lot of vegetables, a lot of fruits. One of the reasons that we've had such an epidemic, especially in children, is high-calorie drinks. Is the one Coke a day is worth a 10 to 12 pound weight gain in a year. 2 Cokes a day is worth a 20 to 24 pound weight gain in a year. And any liquid calories, like this orange, if I eat an orange before lunch, I'll eat 60 or 70 calories less at lunch and be satisfied. If I drink a 150 calorie glass of orange juice or 150 calorie orange soda before lunch, I will eat at lunch the same calories as I would have if I hadn't had anything, because my body does not read those liquid calories as calories. So that's why most of us, unless you're very thin and have no problem whatsoever, most of us just need to stay away from calories in your drinks. And that includes juices. If you want the orange juice, eat the orange.
So those are habits that we learn at an early age, and especially for men, we can learn to drink water, which is healthy for us, it
Right.
sounds like, and make some good choices. So we've talked about blood pressure, we've talked about cholesterol, we've talked about blood glucose, your body mass index, your height per your weight, where you are as far as those risk factors. As we move towards the 40s and maybe 50s and even 60s, what do men need to maybe start thinking about being screened for? We talked about cancer, and we know we don't want to smoke because that would be a risk then for lung cancer. As we get into colorectal cancer, when should that screening take place?
Well, as you're going, colorectal cancer starts at 50, and we are now, and we're real proud of that fact, we're decreasing the death rate from colon cancer in the United States. We've got the highest rate of colon cancer in the world here in the United States and Western Europe, primarily because of our diet. But every colon cancer starts with a polyp, and the polyp has to sit there for 10, 15, 20 years, a long time before it turns into a cancer. So if you have a colonoscopy at 50, and it starts at 50 in men and women, and then have it every 10 years, we decrease that risk tremendously. And right now, because we're doing colonoscopies, and I've had 2 colonoscopies myself, I'm 65. Actually, I'm 66. But anyway, I've had 2 colonoscopies myself, and it's just, but we are decreasing the death rate from colon cancer, and that's been one very important thing to screen for. Getting back what men need as they get older, one thing is exercise, and I see a lot of my 20 and 30-year-olds exercising, and then they tend to drop off exercise in their 40s or 50s. You don't need to do that. Exercise is more important for me at 66 than it was for me when I was 36. And it's just the amount you need for most of us is 30 minutes a day, 5 days a week. And that helps you with both your weight, it helps you with a lot of other things. It's good for your bones, it's good for your heart. Your heart doesn't need quite that much. Your heart only needs about 3 days a week, 30 minutes a day. But most of us for weight loss need 30 minutes a day, 5 days a week, or an hour a day, 6 days a week. And frankly, I don't lose weight until I get to an hour a day, 6 days a week. But I can maintain I ride my bike to work, I ride my bike back home, and it gets me about 40 minutes a day. And so but you need to find some sort of exercise, and men need to find some sort of exercise that works in their lifestyle. And a lot of people can exercise at work. And when we talk about exercise, it doesn't have to be running. It can be, we're talking about a brisk walk and the equivalent thereof. So a lot of people can exercise at noon at their job, and they can hop on a treadmill one of my patients has a stand-up desk, and under his stand-up desk that he types on and uses a computer on, he has a treadmill running, and so he's walking all the time. And he only can do a mile an hour and still type and not be bumpy with everything and hit the keys. But he's moving all day, and he tells me how much he can eat, and he just eats these huge quantities and keeps his weight just fine. And so that's. But the point is, we don't need to drop out exercise. Exercise can't be dropped out. You have to exercise, and it's also good for depression too. It decreases your risk of depression and anxiety.
Well, it may not be the same type of form of exercise that they may have had at early years, which might have been team sports or organized sports. This is finding something that you can do within your daily routine to keep you active and keep you moving. So it might not be just that game of basketball on the weekend. Yes, we want you to get moving, but you need to have it be consistent.
And it needs to be what you can do. A lot of my 50-year-olds drop out running and they start cycling. But I have 60-year-old runners. So, it's tennis becomes more of a backcourt game rather than running to the front court. But you can still exercise, and we all need to. These bodies that God gave us are meant for that.
Yeah, so it's important to eat right, exercise, not smoke, and then starting as we get into our 60s, we talked about colorectal cancer. What about prostate cancer and that risk? When should that screening start from then?
Generally, that starts at 50, but we've not been as successful about decreasing the death rate from prostate cancer. So we're still working on that. But generally, we start doing a rectal exam. That's just, and then and sometimes the PSA, sometimes not. That's somewhat controversial. We've really decreased the death rate from colon cancer by our screening. We haven't done very well with prostate cancer. We still check for it though, and it's a common cancer in men.
And something, again, to talk about your personal risk factors, your family risk factors, and lifestyle risk factors, then when that screening should start with your physician.
For instance, if your mother or father or sister and brother had a colon cancer in their 40s, you want to start 10 years earlier with your colonoscopy. So if your mother had a colon cancer when she was 40, you want to start with your colonoscopy when you're 30. But generally, you start at 50. 50 is when most of the screens start. And there's a new screen for lung cancer, and we're #1 in lung cancer in the United States because of the smoking. And that's a CT scan of the chest between 55 and 79 if you smoked 30 pack years, and a pack year is a pack a day for a year, and most smokers have accumulated that much by the time they're 55 if they've consistently smoked. And have not stopped smoking within 15 years. That's a new recommendation. It decreases your death rate from lung cancer by 20%, so it's not 50% or 80%, but it is 20%. And right now, it's a screen that's the CT scan of the chest, not a chest X-ray. Chest X-ray doesn't help, and we stopped doing those years ago. But the CT scan of the chest does decrease between 55 and 79. Does decrease the death rate from lung cancer by 20%. But that's new. Frankly though, but this just gets us back to, just the common things that we want to do, which is, try to stop tobacco as early as possible, eat a good plant-based diet, exercise. It's not rocket science, it's a few simple things that we all need to be doing.
I agree, and I think we've also been, stressing the fact that the preventative screenings are something that you talk with your personal health care professional about, again, your risk factors, when do I need to be screened, and you had just mentioned, previously the colorectal cancer, but then also the lung CT that is now out, to detect your risk factors for lung cancer. That's something that you have to meet certain criteria in order to even jump to that point.
Yeah, you wouldn't do that if you weren't a smoker, if you hadn't had 30 pack years, if you weren't between 55 and 79, and then nobody's paying for it currently. So it's a $200 X-ray, and it's on your nickel, not anybody else's. Right now, that may change. It's a new recommendation.
Well, we've had some great conversation about what men need to do as far as getting in there for that preventative care and not waiting till they might have that ache or pain to seek that medical attention. Any other tips that you might want to give our male population?
Well, one thing that's that people are talking about a lot right now is testosterone. And right now, we don't know where we are as far as giving testosterone to men. If people have problems with both libido and erections, and their testosterone is very, very low, those people probably benefit. But most of the men that I see, we all decrease our libido as we get older, and that's normal. And erections are more of a problem as men get older. But fatigue and that sort of thing that happens just with age, taking testosterone for those things is probably being overdone now. And there's accumulating studies that it may have some harm. And so we just don't know where we are from a testosterone point of view. So being conservative with that is a better idea. And using testosterone the FDA has approved it. It does have some uses, but it probably should be in a more constricted than it's being used right now.
We just don't know the long-term effects.
We don't know the long-term effects.
Yeah, it's being highly marketed right now.
And the reason it's so people are talking about it is the marketing, and only the marketing, because there's very little data that giving testosterone to people who are borderline low it helps them very much, and it's expensive. But even more than that, it's possibly a health problem. It may increase heart attacks and strokes. The data is small, and the FDA is still okayed it, and I've got a number of people on testosterone, but we just don't know where we are. It took us, with women, we have a fair idea of where we are with hormones, and we're using less and less hormones for women. With men, I think we're probably going to come back to that. We're going to find that we only use it for a very small number of men whose testosterone is very low, who have both decreased libido and decreased erections, and have a very low testosterone. And fatigue, it really is not a part of the problem. We're all tired. We all get more tired when we get older. It's just part of it. But anyway, that's a current thing that's out there, and but the reason it's out there is because of the marketing.
Okay. Well, I think you mentioned the fatigue, and I also heard you talk about the depression. So those are things that you definitely want to talk to your healthcare professional about, but maybe start trying a little bit more conservatively with the exercise and diet, those types of things too, before we jump to some of the medical replacements as far as medicine, those types of things.
Absolutely.
Yes. So we've talked about, what about sleep apnea? That tends to be something else that men tend to have more health concerns or issues, I guess I should say, than the female population.
Well, sleep apnea is very important. And my wife told me that my snoring was absolutely terrible, and I do a lot of backpacking, and I'd always have to place my tent a good ways away from everybody else so the other people that were backpacking with me could sleep. And I take care of a lot of people with sleep apnea. So it wasn't until I was in my car at the stop sign at the Brown Pusey house and fell asleep at the stop sign, and gently the car rolled forward and bumped a young teenage girl's car right in front of me, that I decided maybe I ought to get checked for sleep apnea. I did, and I have terrible sleep apnea, and right now I'm very happy with my little CPAP machine. I wear a mask every night. It helps me sleep well. People with sleep apnea don't wake up generally, but they stop sleeping so many times per night that they bring themselves out of the deep levels of sleep, and you have to stay in the deep levels of sleep 60 to 70% of the time to feel rested. So sleep apnea is very important. And you're not going to know if you have it. Actually, your spouse is generally going to tell you, you're snoring. And not everybody that snores has sleep apnea, but that's something that we screen for a lot, especially with men, and especially if you're carrying very much weight as a man. I've had some people who lost enough weight and they get rid of their sleep apnea by losing weight. But Karen, that's right. That's something that should be screened for, because it's something that the person's not going to know themselves.
Right. They
just feel tired. They feel sleep deprived. They go to sleep at the stop sign and bump the person in front of them.
That goes back to that fatigue. So we've hit on some very good health issues and some concerns for hopefully our viewers to think about where they are, what they might want to discuss with their healthcare professional. And we appreciate your time being here with us today, and we hope that our viewers also institute some of the healthy tips that we gave them today too. So thank you for being here, Dr. Gerard.
Thank you, Karen.
Very much. For more information, we'd like you to go to our website at www.hmh.net, and we hope you tune in next month for another important edition of Health in the Heartland.